Also, it's the 29th of September, and today marks the World Heart Day. The day is observed every year to raise awareness about heart disease and also preventive measures that can help prevent and manage cardiovascular diseases. Well, here on The Pulse today, we shed light on the prevalence of cardiovascular diseases in Ghana, their causes, symptoms, and also treatment. But first, though, listen to the acting director of the National Cardiovascular Center at Kolebu, that's Professor Mark Marty Tete, speaking on the dangers human activities such as galamsey have on the heart.
Heart for nature. Human beings have caused drastic damage to nature through pollution, and 25% is known that 25% of cardiovascular deaths are due to pollution alone, air pollution alone. About 7 million people in the world die from heart diseases caused by air pollution. The question we must ask ourselves is, in Ghana now, how are we deliberately damaging our environment with devastating effect on our heart health? Let me just cite a small example. Mercury that is inappropriately disposed during galamsey is strongly associated with hypertension, heart attack, stroke, and cardiac arrhythmias. It is time to use our efforts to preserving nature, to reduce and restrict air pollution from entering nature and other damaging practices that are ultimately killing us. The healthier the planet is, the better the hearts of its inhabitants will be. Now, heart for ourselves. Charity begins at home. Before using your heart for others, we must know that you yourself are fit and stress-free enough. We can use our hearts for ourselves, but taking good care of them, eating healthy, exercising daily, and kicking out the tensions and stresses of life are helpful for a healthy heart. Now, let me just share some figures with you. You know, heart disease and cardiac strokes are now the leading cause of death in the entire world. And it's been stated about 18.6 million people die each year due to heart disease and stroke. And in Ghana now, the leading cause of death in Ghana now is from heart diseases and strokes. That's the leading cause of death.
Also, what's the national picture and what's been happening ever since, of course, stakeholders formed this group just to deal with awareness. Let's take you through some of the figures as we have them coming through. On your screens right now, you see that clearly an estimated 17.9 million people died from cardiovascular disease in 2019 alone, representing 32% of all global deaths. Now, beyond that, there's a need for you to know about this, that 4 in 5 cases of these deaths that occurred in low and middle income countries, such as Ghana as we have it. And this is beginning to raise concerns as to the reasons and the need for us to have some measures to tackle all of the challenges that we have. So let's bring in Dr. Phyllis Awindango. He's a specialist and fellow in training for cardiology at the Kolebu Teaching Hospital. Thank you, sir, for spending some time with us here on the Joy News channel. Let's get to it then in terms of preventive measures and how to keep our heart healthy. What are some of the recommendations you would make?
Okay. So thank you for having me. Good evening to you and good evening to everyone listening. So in doing that, we need to look at the risk factors that we can modify. So in terms of the risk of getting the heart disease, we have what we call the non-modifiable. So those are the things that you really cannot do much about. So age, male sex, family history, or ethnicity. But there are others that we can do something about. So the diet, for instance, eating a well-balanced diet, low in salt, more fruits and vegetables, that would reduce cardiovascular disease. Also increasing your physical activity. That also goes a way to prevent or reduce the risk of cardiovascular disease. And just by exercising about 150 minutes a week, moderate exercise can do that up to about 30% reduction in heart disease. Other things are stop smoking if the individual is smoking, and also those who consume alcohol in excess, you advise that they stop or they reduce the quantities of drinking alcohol. Other factors such as stress also contribute significantly to cardiovascular disease. So having to work and distress is also important in reducing cardiovascular diseases. And like the director mentioned, pollution is also now a big factor in terms of cardiovascular disease death. So these are some of the things we can do to reduce. There are also some conditions that also predispose, like diabetes, for instance. We need to be able to control diabetes. Hypertension is a main driver for heart diseases and stroke. So if you're able to control hypertension, control diabetes, would go a long way to reduce cardiovascular diseases and deaths.
You work, at the health facility. Obviously, I'm sure that you've been dealing with a number of cases. What are, some of the very common traits that you get to encounter when you get to the hospital? A reason for which you would want people to be much more aware of?
So obesity is one. We are beginning to see a lot of people who are overweight and obese. So that is also driving the cardiovascular diseases. And like I mentioned, other things like physical inactivity, sedentary lifestyles. So all these would contribute to an increase in cardiovascular disease. So, and like I said initially, these are some of the risk factors. People come with high blood pressures who would come only if they've had a heart failure, a kidney problem, and they would have had blood pressure for a long time without even knowing that they have it. So these are the people we tend to encounter commonly with some of these heart diseases.
Today we're marking the World Heart Day. If there's a message that the general public would have to be aware of, what would that be?
Yes, so this year's message seeks to encourage us so it's use heart, know heart. So as an individual, you need to know the state of your heart. So if you haven't screened your heart, haven't visited a doctor, anyone to take a look at your heart in particular, you need to do that and know your heart. And in doing that, we are asking that individuals should use your head, compassion, use your influence so that we can together beat cardiovascular diseases as a whole. So let's all try as much as possible, work on these modifiable risk factors, work on our diets. Let's get active a bit. Just 150 minutes a week is not so much. If you drink too much, reduce or stop. If you smoke, you should also stop. Work on your stress levels. And let's also find out from our relatives when they pass on or when they are sick, what conditions they have. Because these diseases also tend to have a genetic or family lineage. So it is likely that if your father died of a heart attack, you probably also get a heart attack. So let's find out from our relations, our parents, the conditions that they have. And we should be able to address them or pick them up early and treat. Thank you.
Grateful. Thanks for spending some time with us, Dr. Felix.
Thanks for having me.
CSO saying health and child welfare-centered organizations are impressing on government not to delay in making funds available for the timely purchase of vaccines for childhood immunization. Now, in 2022, we know that getting through to the part of this year as well, Ghana's immunization drive was impeded by the shortage of vaccines due to delays in payment. In a stakeholder engagement organized by Send Ghana to solicit inputs from children towards the 2024 budget, the Executive Director for Hope for the Future Foundation, Cecilia Seno, indicated that the government must prioritize funding for vaccines in the budget. We have more in this report.
Childhood immunization, hailed as one of the most cost-effective public health strategies to prevent child mortality from infectious diseases faced significant setbacks in Ghana during 2022 and the early part of 2023. The hindrance, a shortage of vaccines resulting from government inability to secure funds for procurement. Leading civil society organizations in the fields of health and child rights, including UNICEF and the Hope for the Future Foundation, have jointly called upon the government to allocate a dedicated budget for children's vaccines. The urgent appeal aims to avert a recurrence of vaccine shortages, which could heighten children's vulnerability to diseases that these vital vaccines aim to protect against. Cecilia Senu serves as the Chief Executive Director of the Hope for the Future Foundation.
Gavi and all other people, UNICEF, all of them support our vaccine. But they cannot own it. The country must own it and have explicit budget line, sustainable one for immunization, so that we can have the future generation protect. It's a whole investment. If you don't protect your children, you end up spending a lot of money treating diseases that are preventable. And so we don't need to have that again in this country. We must plan. We must ensure that the tax that we are all paying, we allocate it for the future of our children.
Social policy analyst Kwesi Asante from UNICEF stressed the need for the establishment of a sustainable funding source for immunization efforts.
And so, as a country, we need to have a strategy. How do we mobilize resources to sustainably procure vaccines? Recently there were some vaccine shortages, and Nigeria had to come to our aid. And we can't continue that way. So it's important that we together as stakeholders, government and all relevant stakeholders, come together and think beyond just 1 year, how sustainably we can finance.
The country representative for the Health Advocacy Incubator, Steven Atasigi Global, expressed enthusiasm for the proposed establishment of a vaccine institute in Ghana. However, he emphasized the necessity for government to commit to adequate financial support for the institute's operation.
I think it excites us as the Global Health Advocacy Incubator and our partners, Sen Ghana and Hope for Future Generations, that the government of Ghana is committed to this vaccine institute. It's exciting to also know that it's even been put into policy, and it's in parliament, and it's an act. These are beautiful, and we are happy and we're looking forward to it. But beyond the policy, the financing aspect comes back to the point. I mean, it's not enough to have policies. You need to fund them, and that's why we believe the government of Ghana should go out on its, all out, to dedicate financing for epidemic preparedness and immunization. There is no excuse for this.
The collective engagement convened by Sen Ghana seeks input from civil society organizations and citizen groups on epidemics preparedness and response, with a specific focus on shaping the 2024 budget. Emmanuel Aifa serves as the Deputy Country Director of Sen Ghana and underlined the importance of this stakeholder dialogue.
As a development-focused organization in Sen Ghana, we try as much as possible to bring people together every year, because ordinarily it will be difficult for the ordinary person to actually reach out to the ministry, not only Ministry of Finance, but all the sector ministries, to actually send if they have any suggestions or any inputs into the budget. So this is something we do. We bring the ordinary citizen, we bring persons with disabilities, we bring adolescents, we bring young men and women, we bring traditional leaders, we bring people also from the various district assemblies, technical people as well together, and of course we bring civil society together. The point is that if you have the opportunity to meet the president, or to meet the Minister for Finance or Minister for Health, or any of the sector ministries, to actually say to them one very important thing that you want seen in the 2024 budget, what would it be?
Prince Kwame Kudiger's report read to you.